Hello and welcome to See What We See with Lauren and Martin. My name is Lauren Cashin. I'm the Executive Director of the Ontario Opticians Association, and I'm here with my co-host, Martin LeBeau, Deputy Executive Director of the Ontario Opticians Association.
Hello, everybody, and welcome to See What We See with Lauren and Martin. How you doing, Martin?
I'm good. How about yourself, Lauren?
I'm doing great, thank you. Martin, you know, we've, ever since the pandemic started, as practicing opticians, we've had a lot of conversations about contact lens fittings because we've had a lot of mixed messages, whether it's been from outside medical sources or from our own regulatory body, the College of Opticians. And, you know, it's gone everywhere from, you know, back in March where we were told we were essential services, but only do emergency things for your patients, but they were very strong about telling us not to fit contacts. And then that kind of evolved, you know, when we started opening again in June. And I know yourself, you didn't, just like me, we didn't wish we should be fitting contacts or not. It was very confusing times, wasn't it? It was.
Oh, definitely. There's a lot of mixed messages out there, and definitely as we learn more about COVID and how it reacts, there's more information coming out, better information coming out. So I think we'll be able to have a great conversation about this today.
Yeah, so again, it has evolved because it is science, and it's good no one stands on ceremony and saying they stated something way back when, whereas the science has evolved. As you said, we're learning more about it. And well, I won't get into how it's evolved right now with the college saying this, that, I know, but I will mention that right now for opticians, our college says that they discourage the fitting of new contact lens fits, but that's pretty good because he evolved from strongly telling us not to do it. So it's still evolved. And then of course we want to be in line with the College of Optometry because many opticians do work hand in hand in practices with opticians. So without me going on and on and on, Martin, why don't you introduce our guest for today?
I would love to, Lauren. Thank you. Guys, we have today with us Wes McCann, Doctor of Optometry. Hi, Wes. How you doing?
Good. How are you?
I'm excellent. Thank you very much. Maybe you can start by talking about, let us know a little bit about yourself before we get going.
Well, my name is Dr. Wes McCann. I am an optometrist in London, Ontario. I went to school at Western University and did my Bachelor of Biology there, and as well honors Bachelor of Science in Kinesiology as well. And then decided to go down to Florida for optometry school, where I went to Nova Southeastern University, got a Bachelor of Vision Science, as well as my optometry degree and an accelerated MBA. Came home and ended up joining my father-in-law's practice, and since then purchased his practice and 4 more. So I'm up to 5 practices, full scope optometry practices. My downtown London one has a subspecialty dry eye clinic. So that has been doing really well. I lecture for Johnson & Johnson, and I've lectured for Optician, Zeiss, B&L, and a few other companies as well. So enjoy the teaching as well as consulting and in private practice as well.
Oh, that's great. Sounds like you're a busy man as well. I like that. Well, you know, that when you enjoy what you're doing, it's not work, right? It's a hobby almost. So
Exactly.
it's a pleasure doing it.
Absolutely.
Maybe we can start by talking about a little bit about the mixed messages we got back in March when, you know, COVID really hit. I'm going to say the stores and the practices. A lot of the talk was about the risk of contracting the COVID through the tiers. Maybe you can let us know a little bit about that, how you felt about it when you heard about it and what you've discovered since.
Sure. So there certainly is no absolute right or wrong answer to this. Everyone has different comfort levels when it comes to COVID and COVID exposure, and you have to make sure you're respecting those comfort levels that people have. But we certainly want to look at the evidence and what public health is saying, and recommendations that have come from different governmental bodies. So we're respecting all those and adhering to those policies. But when it comes specifically to tiers, although conjunctivitis has certainly been observed in COVID-19 cases, it is quite rare. And most of the evidence is showing that the transmission through ocular tissue is really anecdotal. So we want to make sure that, again, we're aware that this is a potential problem, But if we're screening our patients properly and we're doing all our different controls, so our administrative controls where we're screening our patients prior to coming in, we've asked them about exposure to COVID-19 and if they've left the country and if they have any symptoms or signs of COVID-19. Those are our administrative controls that we're able to manage who's coming into our practice. And then also our environmental controls within our practice about social distancing and such. So if we're doing a contact lens teach, for instance, or a contact lens fit, we do have to get fairly close to that patient. But again, if they're masked, we're using proper hand sanitizing procedures. We've done our administrative controls with the screening. We have a breast shield in place and a slit lamp. We have a lot of different controls in place for the fit portion. And then when it comes to a training, again, we can maintain some distance when training a patient with insertion and removal. We can utilize tools, online tools, such as sending a video to the patient ahead of time on information, or an instructional video rather, on how to insert and remove contacts, so they get a chance to watch that prior to, and then when they arrive to the practice to have their teach, it would potentially take less time. And then again, PPE is a big one as well. So making sure we have enough PPE in place so both the staff member and the patient or the optician, optometrist, and the patient, everyone who's in close proximity is wearing a mask, wearing eye protection. And I would go to the length that the person that's teaching the patient to put or the insertion and removal for contacts should also be wearing gloves and a face shield. They're going to be in close contact with that patient. So again, adding that extra level of protection. And then again, if that patient's done a teach in a specific area, obviously everything in that area gets sanitized prior to and after the teach, so that there's no risk of transmission from surfaces. So again, we're managing administrative controls with screening patients, environmental controls with social distancing within the practice, and being able to get that patient to watch videos ahead of time to decrease the chair time, and also with PPE, making sure that both the patient and the teacher is properly suited up to be able to protect themselves and each other.
Absolutely. I think we all have to be flexible like that. And, at the end of the day, we want to make sure our staff is safe and our patients are safe too, right? So that's why we keep evolving. One of the things as well that came out through some studies, I'm not very familiar with all the studies, is the uptick in conjunctivitis related with COVID. Have you seen any of those collaboration between basically COVID and conjunctivitis?
So I did read a study that did indicate that there is a low occurrence or prevalence of conjunctivitis with COVID-19. Evidence is continuously evolving and changing, but I did read that it's a fairly low percentage, and I think I recall it was around 2%, but I don't want to quote that 100%. I have to recall the study, but that also provides ease of mind when we're fitting contact lens patients. And again, we're doing so many screening protocols when a patient arrives. So are they symptomatic? Have they been exposed to anybody that is positive for COVID-19? Have they been out of the country in the last 14 days? And if all those are negative, those are a lot of your administrative controls, controlling who comes into your practice. And then once the patient's in the chair and you're doing a contact lens teach, if they don't have an active conjunctivitis, then I'm much less concerned that they're going to be COVID positive. So again, it's all mitigating risk and all the control factors that are coming in. So even though you can get COVID-19 and it can present as conjunctivitis, and if you have no symptoms and you don't visibly have conjunctivitis and you haven't been exposed to anybody that's tested positive, your risk factor is quite low because you still have PPE on and you still are protecting yourself and the patient.
So I guess that's where that whole scare came from, where we were afraid to touch somebody's tears because conjunctivitis, its eyes, and conjunctivitis, as we know, is extremely contagious. So that's good. So what you're saying is that in the end, the prevalence was pretty small, that it wasn't really a direct connection between conjunctivitis and acquiring COVID.
And I would say even on that note, like when we were doing contact lens teaches before, if a patient had conjunctivitis, we wouldn't be doing a contact lens teach that day. So we would be waiting until that conjunctivitis is cleared up. So again, you putting those controls in place, those administrative controls to ensure that patient's not in your chair in the first place, and wait the 14 days after that conjunctivitis has resolved, you're again following all the evidence and you're following all of the protocols for screening your patient in the first place.
So maybe we could talk about actually the fitting. If a patient does want to get into contact lenses, actually before we talk about fitting, because you see all these articles about, well, at first it was no, don't wear your contact lenses. I think even the higher ups in the U.S. were saying don't wear your contacts during COVID. Then they came out. So now there's been discussions about what's even more dangerous, wearing glasses or contacts. For a while there, someone was saying, oh, well, wearing glasses, that's helped shield your eyes from COVID, which of course, unless they're goggles, they're not going to really shield them. And then wearing glasses with the fogging issues. So that's probably what stimulates some interest in contact lenses from our patients. So people are asking for contact lens fits, maybe even more so. From my research I did, and some preliminary talks we had, I understand that you've had a lot of new contact lens patients since you reopened in June. So it's not true that you shouldn't wear contacts, obviously. So what's more dangerous, wearing glasses that are fogging up where you're touching them all the time, maybe playing with your mask, or is it better to wear contact lenses? And just for me to ramble on still, when they do come in, how do you go about fitting them? Because this is what should the patient look for? And then we have, of course, opticians in the audience, which have protocols in place. Maybe you could run through some of the safety measures and protocols that patients should look for and opticians and optometrists should be adhering to.
Sure. So when I think of risk with COVID-19, a lot of that risk comes from touching your face. And the risk involved with touching your eyes, touching your mouth, touching your face, when your hands aren't necessarily sanitized and clean. So when would we be touching our face? So if you're a spectacle lens wearer, if your glasses are fogging up, you're going to be adjusting them, moving them around, pulling your mask down, adjusting your mask, everything to adjust for the fogging. So that's an issue in terms of risk. So we'd be certainly touching our face if our glasses are fogging up. If we look at contacts, generally, if you're in a very comfortable contact, you shouldn't be touching your face. But if you're not in a comfortable contact, you may be rubbing your eyes, you may be adjusting the lens. There was a study done that shows that 89% of patients that have irritation rub their eyes and mainly adjust their lenses or move them when they're uncomfortable. They use eye drops, which again is touching your face. So again, you want to make sure they're in a comfortable contact lens if you want to reduce the risk in a contact lens patient. So again, I think you have to think about what's the risk of touching your face and touching your eyes for your individual patients. So when it comes to glasses versus contacts, I think there's positives to both and negatives to both, but I don't think one is exclusively better than the other. But I think if you're in a good contact lens and a comfortable contact lens, it can be a great option for a lot of patients because you're avoiding the fogging, and again, you can have a very healthy, hygienic option for your patient. So again, I would really look to comfort, and again, I look to evidence as well. So if I'm fitting a patient in a contact lens and they're a new wearer, I always reach for a daily disposable because it goes in the eye after their hands are sanitized, and they really should only touch it again when they remove it and throw it out. So I think that's the most hygienic option. And the evidence also shows that the negative adverse events that are associated with daily disposables are far less than those associated with reusable lenses. So again, another healthy option as to why you should be in daily disposables. And then, like I said, when you're in that daily disposable realm, look to comfort as well. So what's going to likely be the most comfortable lens option for your patient? And look to the evidence as well. So if we look, there are certain studies that do an excellent job at publishing clinicals on comfort and going head to head with other lenses in the industry and compare patient satisfaction in terms of comfort. And they don't just look at wetting angle and looking at moisture content or anything like that. They look strictly at patients' feedback on comfort. So Oasis One Day came out a couple years ago, and it was an excellent lens that went head to head with DT1 and went head to head with the other daily disposable lenses on the market and beat them all out from a comfort standpoint. So again, that's not the only daily lens on the market today, but it's certainly one that has some evidence behind it. So again, I looked at the facts, looked at the evidence. I think daily disposable contact lenses are a great option for patients during the COVID pandemic.
And this is a great opportunity to even talk to your patients about daily disposables, because if they're not in a daily disposable already, many patients are wearing their lenses significantly less than they were before because they're not out and about. They're at home most of the time. So they may not be wearing contact lenses every day. So it's a great opportunity to have the conversation about daily disposables with patients. If they're wearing them 3 to 4 days a week, that's kind of your break-even point cost-wise between a daily disposable and a reusable lens once you factor in solution and such for the year. So having that conversation with the patient, getting them in a better, healthier modality and a more comfortable lens, I think is a great option for keeping patients in a healthier state with COVID. So again, like I said, both glasses and contacts have their pros and cons, but I think when used appropriately, contacts are an excellent option for patients, and we certainly don't have the issue with fogging with those.
Yeah, I'm glad you brought up dailies. I mean, I've seen a shift as well in my practice. We fit a lot more dailies. It's, again, safer, right? But that brings it maybe to my next question to you. Soft lenses versus a hard lens. What's safer there? I mean, a soft surface you would think would retain more chance of getting COVID than maybe a hard surface, but I don't know. Is there any researches on that or anything like that? And of course, not a lot of people wear hard lenses. It's not as comfortable, but we do know that they're very healthy lenses as well. Yeah, maybe you can comment on that.
Yeah, I haven't seen any evidence with regards to retaining COVID in a soft lens versus a hard lens. But if you want to compare a soft lens to a hard lens, I would say potentially your better option is orthokeratology, because that patient's wearing that lens at night when they're sleeping and they wake up in the morning and they don't wear anything all day. That might be a better option than soft lenses. But again, that's a whole different ballgame, and there's only a certain number of patients that are candidates for it. So I think a soft lens is still a very healthy option and reasonable for patients. And then again, I look to the comfort part. So if I have a patient wearing a GP lens, what's the likelihood of them touching their eye versus a soft lens? So again, it all depends on your patient base. If they've been in a GP lens for a long time and they don't have any adverse complications, they don't touch their eyes often, they're comfortable in it, that might be a great option for them still.
So Wes, you mentioned, again, we all know that, wear a lens once, throw it away. It's the ideal, obviously. Yep. The ideal, which brings up the whole idea of disinfection and disinfection systems. I don't know how long COVID could last on any contact lens. We know with glasses, there's another maybe reason. How many people disinfect their glasses? Glasses are a hard surface, and we know that COVID likes to live on certain types of hard surfaces. And I'd love to challenge, if we did a study, I'm sure most people aren't disinfecting their glasses. Hopefully they spritz them once in a while to clean them, right? Let alone disinfect them. So when it comes to, again, like you mentioned, daily wear lenses, and as Martin said, his practice, as of mine, we've evolved to, it's always our first option if there's a lens available in that patient's prescription. So having said that, not everyone can have dailies. It's expanding all the time, parameters. So how do you feel about the different ways of disinfecting lenses? Is there one better than the other, especially for COVID? This is stuff we always talk about anyways, but with COVID, is there a little more information out there?
Yeah, so I haven't seen any published literature in terms of comparing the multi-purpose solutions versus the hydrogen peroxide solutions. We know hydrogen peroxide is effective against killing COVID. So, and I haven't seen the literature on the disinfection multi-purpose solution. And again, we're a 90% daily disposable practice. So we certainly, our number one has always been the hydrogen peroxide solution for recommending for patients. But the new AccuView VitaLens solution actually has the same cleaning power and disinfection power as a peroxide solution, but it's a multi-purpose solution. So I would anecdotally, I would have to see the literature on it, but I would expect it to have the same killing properties against COVID-19 as a hydrogen peroxide solution. And again, we can certainly look into that more, but that would be my expectation. But I would definitely want some clarification on that. But I started to recommend that solution only because it is the convenience of a multi-purpose solution, but the cleaning power of a hydrogen peroxide solution. So those would be my two that I would usually go to.
Cool. I guess that brings up something else that I just want to mention. Washing your hands. You know, we've always counseled our patients to really wash their hands whenever they go to touch their contact lenses. And I guess it's even more important now in the times of COVID that we should be scrubbing our hands constantly, especially before we start touching our faces and inserting our contact lenses, and maybe case hygiene. You know, people, we've seen those people come in with their reusable lenses with their little contact lens case that you want to just pick up with a glove on and toss in the garbage. So I guess, again, hygiene is just, our hygiene focus should just be amplified, I guess, during COVID.
Hand hygiene is extremely important. Again, we see every building that we enter, we are hand sanitizing or washing our hands. So hand sanitation is of the utmost importance right now with COVID. So especially if you're a contact lens wearer, we need to make sure we're washing our hands for the 20 seconds plus with soap and water. Soap and water is very effective against COVID. So using a good hand washing technique prior to inserting or removing your lenses is going to be of paramount importance. And again, even if you're a glasses wearer, washing your hands regularly is going to be important because, again, patients are adjusting their glasses often, touching their face, frustrated with fog, etc. So I don't think I could stress enough how important hand hygiene is.
Wes, I'm just going to go back a little bit about we were talking about comfort a little bit earlier on. With all the hand sanitizers and the sprays and the you know, you go to the grocery stores, you use some of their sanitizers and there's fumes, you know, they're very heavily alcohol based and everything else. Have you found that some of your clients or your patients, their eyes have been drier because of that? I find that I've been, recommending more and more drops because of it. And of course, we're getting to this type of weather right now that, you know, the heat in the car goes up and stuff like that. But have you noticed any of that?
So it's funny you mentioned that. I actually run a special, a dry eye clinic here at one of my offices, and we do IPL, radiofrequency, LipiFlow, iLux, all of those treatments for dry eye. And we have noticed an increase in dry eye signs and symptoms from a lot of patients. But there is some published literature on mask-associated dry eye as well. So just with wearing masks and how that blows straight up into our eyes when we breathe, there is definitely the mask-associated dry eye syndrome that exists right now. And then there also is all the increased screen time that everybody's having.
Screen time has been greatly increased since the pandemic started. So we know that when a patient is sitting there chatting with each other, like if we're sitting there chatting with each other, the patient and I are each blinking on average about 14 times a minute. When you go to an electronic device, that blink rate drops from 14 to 4 on average. So huge drop, and that drop makes the dry eye significantly worse for patients, increases the risk of MGD and worsening MGD because our blink, our natural blink pattern, isn't stimulating those meibomian glands on a regular basis within our lids. So the oil gets backed up. We can get a biofilm that can certainly form on the lids. Just anybody can get that, and those glands, the oil that's in those glands gets much more turbid, doesn't have the same consistency, can't coat the tear film as well, and tears start to evaporate a lot faster. So we run into a situation where we're on screens, we're not blinking enough, not stimulating the oil glands, so the oil doesn't get produced as well and doesn't coat the tear film as well, so tears evaporate faster, and we're already not blinking enough, so it just kind of exacerbates the situation and makes it worse and worse and worse. So a lot of patients are finding towards the end of the day, eyes are extremely dry because they're on their electronics all day. We're working from home, we're doing a lot more virtual consults, virtual meetings, Zoom meetings, or wherever your platform of choice. And again, screen time on devices is increased substantially since COVID started. So we are all on our electronics much more, and that is definitely making dry eye significantly worse. So there are treatment options, there are options available for things that we can look at. Some of the older technologies in contact lenses don't fare as well with a decreased blink rate. So certainly updating patients in contact lenses and in a more up-to-date technology would definitely improve tear evaporation rate, et cetera, on patients' contacts. Again, daily disposables being a benefit over reusables. There's all sorts of things that can improve screen time. We even have contact lenses now that have blue blocking technology in them, the Oasis with transitions. So there's lots of tools in our toolbox that we can look at for managing dry eye disease with patients and screen time use.
So when we're having those conversations with patients, again, even more so important to have the conversation about comfort, because you want to make sure they're in the most comfortable lens possible, and what was comfortable for them before may not be comfortable anymore. And you want to make sure you're picking a lens that's going to be really suitable for that patient during the pandemic. And like I said, it's no better time to try to get them in daily disposables. And once they try daily disposables, they never go back to reusables because of the convenience and the comfort and the health of it. So it's a great time to get them into a healthier modality.
Cool. So I think, well, that's a lot of information. I think very valuable information, especially for contact lens wearers. And as you talk about things, it's like, even as a practitioner, I'm sitting here thinking, you talk about the dry eyes from wearing masks. I'm a dry eye sufferer to begin with. And when I do go out, which I don't go out that often, when I'm grocery shopping, with that mask on, I'm finding my vision is fuzzier and fuzzier because of the dryness. Still not used to the mask thing. It still causes some anxiety, and then when you're not seeing properly, and anyways, it's we're not at normal times right now, and hopefully coming up soon. Martin, do you have anything else to add at this point?
I don't. I mean, I think this was a great conversation. I'm sure there's more questions that are going to pop up later on as, again, things evolve and we get to learn more about some of those white papers and everything else. Like you just mentioning masks. I mean, maybe at some point we'll be able to recommend a specific type of mask that's going to be better for your eyes, for less dryness. That kind of be cool to know that information and provide that to our clients and patients.
Taping your mask makes a big difference with some surgical tape, but not everybody wants to be taping their the skin every day, and it does a number on your skin as well, depending on what adhesive you're using. So, but it does make a big difference for those extreme dry eye sufferers that are out there. But again, I wouldn't want to be taping my face every day.
Well, just to add to that, Wes, since you brought it up, I just read or watched a video or something. It was a doctor in a hospital, and he was taping his masks, and it was killing him, as you said, especially across the bridge of his nose. So just as a little pearl, he says use a Band-Aid. So the part that goes across your nose is the gauze, not the tape. So a little less tape on your nose. So, I guess all these little pearls are going to start popping up, as we go forward, because I think even once a vaccine comes, I think masks are, they're here to stay, maybe not quite as often, but I think societies, this was a real awakening that it can happen. The scientists have been saying for the last 20 years this was going to happen, and not here, can't happen to us, right? Not in North America. Stuff like that doesn't happen. So another good pearl. So Wes, I'd like to, if we have nothing else to add, I'd like to thank you for coming on. I'd like to thank Johnson & Johnson for sponsoring today's show. And it's great. I'm hoping we can ask you to come back again, because I think this is a great topic. And now that we know with, how all this expertise you have in the contact lens world, maybe, we can have some other topics related to that you'd like to talk about with us. So,
sure. Sounds great.
Hey, thank you very much, Wes. Great conversation, and really looking forward to catching up again sometime soon.
Yes.
Thanks. Same here.
Yeah. Thank you, Wes. Have a great day.
Thanks, guys. Stay safe.
You too.
Thank you for listening to See What We See with Lorne and Martin. Be sure to follow us across our social media pages so you never miss an update or an episode. You can find us on Twitter at OOA_frontline. On Facebook and LinkedIn, we are Ontario Opticians Association. Follow us on Instagram at Ontario Opticians Association. That's all one word. We look forward to seeing you again on See What We See with Lauren and Martin. Take care and stay safe.